welcome to another episode of Hola Meds, powered by R.A. Williams. I'm your host, Kimberly, and today we're going to be tackling heartburn and GERD. Those symptoms seem to be so much more prevalent at this time of the year, when we're enjoying all the festivities and indulging a bit more. So joining us today is clinical pharmacist, Dr. Ernestine Watson of Everybody's Pharmacy. Hi, Dr. Watson.
Hi, how are you?
I'm doing well. It's nice to have you. You look great.
Thank you. You did a great job of making me look great.
We had a good place to start.
Yes.
So it was no issue at all. Is heartburn more prevalent during this time of the year?
Well, actually, yes, because we are eating more, we are drinking more, and the basic thing is that we are doing things that we don't normally do. So we engage in a lot of extra alcohol, we engage in a lot of spicy seasonal foods, the sorrel, the gungo peas, the ham, extra cheeses. So it does have an impact.
And those are staples you just mentioned, those are staples on the dining table.
Of course.
Those seem to
they should be too.
Yeah. But they sound like triggers. But we'll get to that later.
Definitely.
And just for the viewers, what is the difference between heartburn and GERD?
Okay, so let's think of it as the preliminary early stages, and if it's not managed, then we can progress to a chronic or a long-term condition. So heartburn can be experienced by anyone if you do something outside of the norm. So take for example, you may eat a lot more than you normally do. Right? Or you may eat foods that you're not, when you travel and you start tasting the cultural foods, like I'm a Trinidadian, and when I go home, I can suffer with heartburn because I eat so much outside of what I eat normally. So anytime you start eating outside of your normal, then you can experience heartburn. And heartburn can present as a burning, sometimes you feel like you're regurgitating, so the food comes back up.
Or you burp and you sort of taste.
And you have a taste
of the meal before.
And the burning that may occur. So basically that is heartburn. Heartburn is also...
Is it really a heartburning?
No, it's just you feel a burning,
it's
near to the heart,
area.
so we call it a heartburn.
Okay.
It's known as that. However, sometimes the things we do outside of extra eating, we may eat and go fall asleep. That term,
ethnic fatigue,
niggeritis. Yes. So you may have a heavy meal and you lie down, you fall asleep, and sometimes we fall asleep in such a position that the food comes back up through the esophagus, and that gives us the heartburn. So that's heartburn, and that can be managed with care and thinking about how we consume food, and we can
do lifestyle changes.
Yes, we can do some lifestyle changes, and if that doesn't work, we can go to the pharmacy and get something for it. However, GERD is a what we call gastric esophageal reflux disease. That big word, shortened to GERD.
Okay.
And basically, what it is that after a prolonged period of time of having uncontrolled heartburn, it may cause some damage to the esophagus, and then it develops, into GERD.
Okay.
Sometimes too, it's as a result of the, that valve, we can call it, that prevents the food from going back up into the esophagus. And so that is weakened, and then that condition sometimes need extensive medical care.
Okay.
And sometimes, if not by drug therapy, sometimes it may need surgery. So we definitely don't want our heartburn to get to GERD.
So what I'm hearing is heartburn is like a short-term,
every
now and again.
Every now and again you eat outside of the norm, or you do something outside of the norm. And any one of us can get heartburn.
But GERD is a more chronic condition.
Chronic condition, which usually needs medical intervention.
Okay. Understood. So you mentioned, and we touched on that earlier, that if you do things outside of the normal, you have some key foods.
Yes.
Those could trigger heartburn.
Right.
What are some of those triggers?
Okay, so anything with excessive fat, excessive seasoning. Sometimes you may have intolerance for certain types of food high in acid. So even some foods like oranges, right, pineapple, those
Citrus.
acidic foods can cause heartburn. Of course, if you have seasoned food like your pizza and those,
Or
it can very spicy.
We love a good Scotch bonnet here.
Very
Yeah.
Actually, the Scotch bonnet itself, if you use the Scotch bonnet itself, it may not be the trigger. What is the trigger is the different combination of seasonings that goes along with the Scotch bonnet that can cause the thing. And of course, some persons have allergy. They have an intolerance really for dairy products. So if they consume milk or something like that, it will give them heartburn.
What about coffee? Can coffee
Coffee can, because it's like what happens, coffee is it's a dehydrating thing, and it also is a trigger to produce excess acid. Anything that causes excess acid production will cause or will stimulate heartburn, and if not controlled, of course, can lead to GERD.
All right, so if we know what our triggers are, what are some of the things that we can do then to reduce our chances of getting heartburn?
Okay, so lifestyle changes. First of all, you need to know what your trigger is. So for some persons, they cannot have pineapple. They cannot have oranges. Others, they can't consume milk. Certain foods like stew peas.
Oh boy.
For me, that is a trigger. I love pea soup.
Okay.
I can't have red pea soup because it will immediately give me heartburn. So you need to know what your triggers are. Also, lifestyle changes like when to eat.
Okay.
Make sure after eating, especially dinner, try not to have dinners late. So you want to have a 3-hour break between when you consume food and when you go to bed. So if you consume food at 7 o'clock, it means that you should not be going to bed until about 10 o'clock. Okay. Some persons, the nightcap, you need a nightcap.
Something nice.
You feel for something nice, and that nice may include something like chocolate, right? The chocolate milk, or something to make it nice and calm to put it to sleep. Well, a lot of persons complain that when they do that, they have regurgitation. So the last meal comes back up, right? So try to space when you sleep and when you eat. Okay. If you have a persistent problem with acid burn, then you should try to sleep in an elevated position.
What does that mean?
Means that you sleep with your back a little lifted, so you don't sleep flat. It's also said that if you sleep on your left side, then you are more likely to have excretion taking place and the food passes through. You don't have that slowing. If this food stays in the stomach too long, the likelihood of it being pushed back up into the esophagus is going to be increased. Okay. Right? And the other thing, if you are obese, especially if you are morbidly obese, the pressure that it puts when you go to lie down, or even the pressure that it puts on the stomach, is a no-no with persons who suffer from gastric esophageal disease and heartburn. So weight loss, exercise is important. These are lifestyle changes that will only do you good, not just for heartburn, but generally speaking. Okay? And another thing that a lot of persons don't realize, lack of sleep. When we go to bed, that is when the body does the excretory and digestive processes. If we stay up very late, right, and we get 5 hours sleep, minimal sleep, it doesn't give the body time to process the food. So excretion is affected, digestion is affected, and we have this buildup of things in the stomach that can come back up in the regurgitation.
So whatever it is, you want to watch your diet.
Watch your diet.
Avoid the trigger foods.
Avoid trigger. If you go into bed, space between 3 hours, right? And even when you get to bed, if you have a problem with the heartburn, try to sleep in an elevated position, or probably on your left side.
On the left side.
The studies have shown that when you sleep on the left side, the digestion is
and the final thing was weight loss.
weight loss
Right.
and exercise.
And sufficient sleep to give your body time to process everything.
Yes.
All right. Is that a little harder to do during the holiday season?
Well, during the holiday season, you should prepare yourself, right? You can plan what to eat, So, okay, you want to eat the ham.
Yes.
You want to have your sorrel. You want to have your gungo peas. In Trinidad, we have to have pastels. Oh,
Pastels?
God. We must have pastels for Christmas, okay? You also need like your fruit cake and your rum cake. And you want to have your rum and your whiskey and
Oh boy.
So you plan. Don't have everything on the same day.
Yes.
Right? So space it out. And give your stomach a break.
A few episodes back, I think we learned the term cheat responsibly.
Exactly. We can plan to cheat, right?
Yes.
So, there's this rule, the 80-20 rule. The 80-20 rule says that we eat normally 80% of the time and 20% of the time. My coach in Trinidad, that's what he says to us. 20% of the time we can cheat.
Yes.
So we plan to cheat.
A little.
You plan to cheat, right? And you're going to plan so what am I going to be having this weekend? Right?
So what do I need to do to balance it out?
What do I need to do? And because you have planned, you're not going to have the gungo rice and peas, the gungo soup, the alcohol, everything on the same weekend.
Yes.
So this weekend you have some, and you
and
make
next
sure
weekend.
Next weekend, because the season is long.
Yeah.
The season is long. Give yourself time, especially because not just because you want for persons who are obese, but if you have a stomach problem, if you have a heartburn, you need to manage yourself so that you don't make it get worse and you don't have to spend a lot of money going to the doctor.
Do pregnant women experience heartburn more than?
Yes, they may, especially because remember what is happening. This growing baby is pushing against the stomach and displacing everything.
Yeah.
Right? So pregnant women should rarely take smaller portions of meals, generally speaking, right? So eat 5 times a day, small portions.
So it's not that you're eating less, but you're just eating in smaller portions.
In smaller portions,
okay.
So you don't crowd the stomach and you give yourself time to digest, right? And again, you eat, you may have cravings, right? So you manage your cravings.
All right. So we've done all of these lovely lifestyle changes, but we're still having the symptoms. Are there any medications, OTC medications?
Definitely. So this is where your pharmacist, your friendly pharmacist at everybody's pharmacy comes in. You can come to the pharmacy and we do have a wide range of antacid preparations. Now, a little bit about antacids, how they work. We have most antacids, and I know you do have a brand as well.
Right.
Most antacids have a combination of an aluminum salt and a magnesium salt because they counteract the effect. One is constipating, the other one causes diarrhea. So they counteract the effect so that you can have, you can solve the problem. And some antacids also have a substance in there that causes it to cling to the stomach wall and coat the stomach wall. So you have two. One, you can neutralize the excess acid.
Right.
And secondly, you can coat the stomach wall so that it prevents the damage that may occur. And so you can manage with your antacid. And the antacid, you can take it 3 to 4 times a day. You can take it after the meal, or you can take it just as with your meal so that you coat the stomach and prevent the...
So if I know when I eat these 2 peas, what's going to happen, I just plan appropriately.
Well, I will not encourage that.
Oh, okay.
Because we don't want to eat something that is going to trigger.
In the first place.
Okay. Right? If something is a trigger, what you are doing is that you are irritating the stomach, right? So you irritate the stomach and you try to coat it with the antacid, right? It may
so just
work
avoid
initially,
it altogether.
but in the long term, you don't want to progress to good.
Understood.
Right? So if you have a trigger, the first thing that I would advise is that you avoid the triggers. Right? And if you have to have the trigger, have it in very small amount. But it should not be your go-to. So like you want to drink beers this weekend. So you walk with your new gel or
Right.
your other antacid. No. You want to ensure that you avoid the things that will stimulate the heartburn, because we really want to prevent the patient from progressing to GERD.
Go ahead.
There's another thing that in some patients,
Yes.
you know, there's the H. pylori bacteria that all of us have it, right? Sometimes we have it from very early and our system, it manages it. But for some persons, somehow the H. pylori bacteria, it increases and it can cause a lot of problems. In those patients, if we see a patient come into the pharmacy frequently and, you know, they doing the lifestyle changes and they're taking the precautions, but they're still having this repeat problem, it may be that they need to see the doctor, and it may be that there is an H. pylori infection, and that can only be treated by your physician under medication.
Understood. All right. And of course, if a patient isn't certain if what they're having is heartburn or GERD, then at that point they would need to see a physician.
Definitely, because if you, in addition to it may be H. pylori infection, it could be GERD, or it could be other things like a serious ulcer.
Serious. Can it be treated easily?
Oh yes, that is easily treated. You go to the physician, and the physician will do a test, and once it comes back positive, there is treatment for it. It's not a problem, but it's to identify if that may be the problem.
Okay, so don't shy away from it. Go see your doctor.
Go to the doctor.
Have the conversation. Take the changes into consideration, right? Your lifestyle changes, weight loss, getting enough rest, and of course you've tried the OTC stuff. Then you can take the next step to figure out what's happening.
Right, and the next step is always to consult your physician.
Always.
Because once you come to your pharmacist, right, we are going to go through a series of questions. And if after evaluation we realize, especially if you are a repeat, because some persons, they would have tried every single antacid on the shelf, those patients must see the doctor.
Okay. All right, that's a good point to end it on. Thank you so much, Dr. Watson. It's always a pleasure.
You're most welcome.
And there you have it, guys. Until next time, just go and hold a minute.